Greetings, I'm Danielle Davis, one of the subspecialty dietitians at New York City Health Hospitals, Kings County, and I am here taking over on this episode of the New York City Health Hospitals, Kings County YouTube podcast. So today we're going to be talking about the role of eating well in establishing a healthy lifestyle. So if you ever heard the phrase, the idiom or the axiom, you are what you eat, that can't be truer from a dietitian's perspective, right? Think about it in sort of a very simplistic way. If I'm eating things that are a little nutrient poor, that aren't that great, that are a little salty, I'm feeling bloated, I'm feeling constipated, I'm feeling sluggish, I am not feeling it. So ideally, you are what you eat. And then in a scientific way, it's actually true. We're proteins, carbs, and fats. The vitamins, the minerals, they're little cofactors in the body. They kind of help put everything together. So you want to strike a balance between the proteins, the carbs, the fats. All these fad diets where you're cutting out one of them may not be the best thing for you. Obviously, you should talk to a dietitian about it. But ideally, you are physically what you eat. So you want to make sure you're investing in quality ingredients for a quality body, right? Healthy favorites. So in a sense, that's one of the things that I try to have and practice myself. It's not so much as that everything has to be a salad or everything has to be steamed. Those are great choices, but think about things like nuts and seeds, right? If you love almonds, go for almonds. Very nutritious, healthy foods. If you have people with a nut allergy, you might want to look into things like sunflower seed, right? As a kid, I loved bananas. Bananas can be an excellent, nutritious food, not just rich in potassium, but rich in things like vitamin B6 and certain types of fibers. Ideally, if you pick your healthy favorites from different categories, you are, in a sense, healthier. You are what you eat. And then for the not so healthy stuff, right? Because, basically, a dietitian practices what she preaches or he preaches, everything in moderation. Those things that are not on the food list, those guilty things, those guilty pleasures, those cravings. Define the times for those. It's not so much as that you can't have them, but make it an empowering thing to do. Like choose when you have them, as opposed to just sort of mindlessly eating. That buzzword of mindlessness, mindfulness. There is validation to it. You want to kind of make sure when you're making these active choices, it's an active investment in yourself. Not that you have to look at the food and analyze it. I'm not necessarily saying that, but it's I'm going to have this glass of red wine after and hard work. Sure, I'm going to prioritize that, but then I'm going to balance it out with this great green salad, a nice piece of salmon, everything together, everything in moderation. That is, to me, self-care, right? This is making something that's good for you, what you are. In a sense, you are what you eat. All that being said and done, what if you're running short on time? Willpower to me is kind of a commodity. You have so much to spend on a day-to-day basis. So try to set yourself up for success, right? That's why those healthy favorites are important. If you always keep them around or if you know where to get them and purchase them, then they should be readily accessible to you. If you don't have that level of access, just a little bit of light meal planning, right? If I buy, a few tomatoes this week, what am I going to do with them? Let me have a few ideas on what I can do. Am I slicing them up and salt and peppering them? Am I going to make a homemade tomato sauce out of them? Just a little bit of light meal planning, right? Getting those tomatoes in, getting that nutrition in, kind of taking care of yourself in that way supports good health, right? There was a study presented at the American Society for Preventive Cardiology at Congress for CVD prevention, that's cardiovascular disease prevention. And it found that patients with prediabetes as well as type 2 diabetes, so this is prediabetes being when your A1C is a little bit higher than average, and then diabetes when it's already over 6.5 and thereafter, they followed a 6-month diet and exercise program. And then they had improvements in various measurements like metabolic health. So that's things like their fasting glucose, that A1C I mentioned, but also their body mass index, and oddly and interesting enough, their waist circumference. So think about what you're carrying in the middle, right? So practicing a diet and exercise intervention for a consistent time made improvements. For some people, they even went into what they call remission, which is probably resolving that pre-diabetic state, getting that A1C to drop. That to me is promising, right? It's challenging, but it's promising. So it's not just eating right. It's not just walking more. It's doing things together. It's that role of establishing you in this healthy lifestyle, right? And the idea is setting up for success. When we talk about lifestyle interventions, it's habit. It's behavior-based. It's what you think you can do, what you can commit to. That's what really sort of helps you continue eating well. Because you don't come to see me or my coworkers to tell you to eat a salad. I hope not. I'm hoping that's already sort of intuitive and well understood. It's the how, it's the what. So once you kind of define yourself in this role of eating well, it does become a lot easier. It's always a challenge, but as long as you prioritize yourself, I promise you, it's a lot easier. And then when in doubt, hydrate. There's too many sugary things out there. It's much better to sort of reach for a glass of water. Kind of hydrate well. You find that sometimes we're also confusing hunger and thirst. That will sometimes slow you down. You can sometimes take sips after a meal to help you feel more full. We could always do a little bit better with our hydration. Of course, if you have certain limitations, always discuss it with your appropriate provider. But when in doubt, at least grab a glass of water and start your day off with something well. You'll find that it nourishes you and it starts your day off. It sometimes gets things moving. But ideally, the role of eating well, it's a multi-step process. It's something you need to be consistent with, but it's putting you in the center of eating well. So that is all I have for the role of eating well in establishing a healthy lifestyle. I am Danielle Davis, subspecialty dietitian at New York City Health Hospital, Kings County. Thank you for your time.